KTN News.
Still on the disrupted healthcare services across public health institutions, here is our reporter Catherine Imuraget with more on the clinical officers, their scope of work, and why exactly their strike will cause a deeper crisis for the public health sector. Listen in.
To many, especially in the rural areas, the line between a doctor and a clinical officer is often too thin to tell. For them, they are just doctors, since they manage many of the medical issues right there. However, clinical officers are key in the provision of primary health care. They are the heroes and heroines of the front line. So, who is a clinical officer and what does he or she do?
We are the biological father of the primary healthcare services in this country. We have been serving in this country since 1928. That's the time that clinical officers, we are one of the oldest cadre in this country. And to that extent, we have exhibited that we can be able to offer services, the specific clinical work at all levels.
Compared to doctors, clinical officers are substantially more. These are the men and women who also manage health facilities in the grassroots.
Why is it that that can happen, that someone can be employed to do the same services, paid 15,000, when their counterpart who are on PNP are receiving close to around 80,000? So it is the punitive way of government to divide people.
In the year 2010, the government released a scheme of service that graded clinical officers into various job groups. This is based on their level of education, experience, and expertise. George Gibore is the Secretary General of the Kenya Union of Clinical Officers. According to the union he leads, there is need for a deeper conversation on that scheme.
The Minister of Public Service wrote a letter staying all the draft, the review of scheme of services, and say they are transitioning from the scheme of services to what they call now career progression. But since then, they have never approved or even came up with any.
With the health function now devolved, the union says some counties are giving its members a raw deal. Clinical officers are relatively more and are often the first point of call for patients. Their decision to down their tools could have a bigger impact on thousands of patients who rely on public facilities for health services. Kenya is not the only country with clinical officers in its healthcare system. These health officials are known by various titles in different countries. In the US, they are known as clinical health associates. Clinical associates in South Africa, while UK refers to them as physician associate. Many other countries have other titles. Catherine Imuraget, KTN News, Nairobi.
Still on the health crisis, clergy drawn from different counties